So, hello friends, welcome to the Ask Me Anything. So, this is more of a interactive based session. Okay, so here you can ask me any doubts related to academic or non-academic. So, majority of the doubts we have cleared in the Telegram group, but still we will discuss, and you can interact me in the session with whatever doubts you have. I have tried to put the majority of your doubts. Okay, so we will start with the questions. So let me just see whether it is streaming or not. Yeah, start with the questions. Fine. So if you guys have any doubt, you can just mention in the comment box and I'll obviously take care of it. Okay. So this was the one very important question, that which is the most aggressive form of ameloblastoma. So we know that there are 6 histopathological variant of ameloblastoma. So out of that, which one is the most aggressive? So there is always confusion between the granular and desmoplastic. Okay, so the most aggressive form of ameloblastoma is granular ameloblastoma. Okay, so most aggressive is the granular, while which is the least aggressive? So this can also be a question, which is the least aggressive form of ameloblastoma? It is acanthomatous ameloblastoma. Okay, so there are 6 histopathological variants. Now the desmoplastic ameloblastoma, there is a one very important feature with respect to desmoplastic ameloblastoma, is that it radiographically, when we see it radiographically, it shows mixed lesion. It shows mixed lesion, and on histopath, it gives a kite or the bird-shaped appearance. Kite or bird-shaped appearance. Okay. Now, the second question, Shepherd-Crook deformity is associated with. Okay, so do not get confused between the fibrous dysplasia and the Paget CP. Fibrous dysplasia and Paget's. Okay, so here the Shepherd's-Crook deformity, classically it is shown by polyostotic fibrous dysplasia. I'll show you the image. Okay, so see, this is also called as hockey stick deformity. Hockey stick deformity, or also called as Shepherd-Crook deformity. Now, what is it? It is basically the curvature we see in the femoral neck. Curvature in the femoral neck, and it is a classical feature which is shown by polyostotic fibrous dysplasia. Okay, so I hope this is very clear. Now, fibrous dysplasia occurs as a result of mutation in GNA S1 gene. Okay, GNA S1 gene, which results in overproduction of CAMP. Now, this overproduction of CMP has its effect on the melanocytes, has its effect on the bone pathologies, and as well as it has effect on the endocrine pathologies. Okay, so this is very important. It has an effect on the endocrine melanocyte. That is why in fibrous dysplasia, what do we see? We see cafe au lait spots. Melanocytes and bone. So in bone, we see polyostotic fibrous dysplasia and monostotic fibrous dysplasia. So this is a Shepherd-Crook deformity, also called as hockey stick deformity. Now, floating teeth appearance is a common radiographic finding, right? So what in all conditions where we see floating tooth appearance? So this is a very common query. Now the options can be very confusing, but you'll have to know that there are different pathologies where we see the floating teeth appearance. Okay, so do not get confused between that. No, for floating tooth appearance is only seen in cherubism. It is seen in many different pathologies. Okay, so let's see. It is seen in eosinophilic granuloma, malignancies like squamous cell carcinoma. So what it does, there is a severe periodontal destruction. That is why the appearance is floating tooth appearance. Severe periodontal disease, like your you would have done this in your perio lectures. And cherubism, here the patient, these are most commonly seen in uh, children. These are most commonly seen in children. What do we see? Bilateral jaw enlargement. And the children, these are called as cherubs. Now, syndromes associated with multiple OKC. So you'll have to remember all the syndromes which are associated with multiple OKC. Okay, so you cannot miss out on any one of them. Okay, so we have Gorlin-Gall's syndrome. Gorlin-Gall syndrome, it is also called as nevoid basal cell carcinoma syndrome. Okay, nevoid basal cell carcinoma syndrome. Bifid rib syndrome, and very important. Okay, so generally it is a common tendency that we miss on this point, that is, it also includes hereditary cutaneomandibular polyoncosis syndrome. Okay, very, very important. Now, very important question with respect to amelogenesis imperfecta. Now, KLK4 gene mutation result in which type of amelogenesis imperfecta? Now they're asking the type of amelogenesis imperfecta. So we know that we have a hypoplastic, hypomaturation type. Okay, but KLK4 gene mutation is associated with which type of amelogenesis imperfecta? Now, this is from a very reputed article. Okay, from a very reputed article. So till date, there are 4 genes are involved with respect to amelogenesis imperfecta. So we have amylex gene, enam gene, KLK4 gene, and matrix metalloprotein, that is 20 MMP2, have been reported associated with amelogenesis imperfecta. Now, most cases of amelogenesis imperfecta is seen as a result of mutation in amylex gene. Now, amylex gene, what it does, it encodes for which protein? Amelogenin protein. Now, this amelogenin protein, it is present in the abundance in the enamel. Okay, amelogenin protein. Okay, so majority of the amelogenesis imperfecta associated as a result of mutation in amylex gene. Now, amylex gene mutation can result from smooth hypoplastic to hypomineralized, or we can say hypomaturation. So many forms of amelogenesis imperfecta associated with amylex gene. That is, we can say that all forms of amelogenesis imperfecta associated as a result of mutation in amylex gene. Enam gene, particularly enam gene, so it has been said that it is associated with hypoplastic amelogenesis imperfecta. While MMP20 and caliclin 4, these both are seen as a result in hypomaturation type of amelogenesis imperfecta. Okay, so the question, caliclin 4 gene mutation result in which type of amelogenesis imperfecta? It is hypomaturation type of amelogenesis imperfecta. So remember, it gives hypomaturation. Hypomaturation type of amelogenesis imperfecta. Yes, it is seen in squamous cell carcinoma. That is, severe periodontal destruction occurs in the squamous cell carcinoma. That is why we see floating tooth appearance. Floating tooth appearance. I hope this is clear, Akshar. Okay. Now, large pulp chamber. So this is a question of developmental anomaly. Very, very important. Okay, developmental anomaly. Large pulp chamber is seen in which type of pathology? So we have clearly discussed in all our sessions, YouTube sessions and live sessions also. So it is seen in dentinogenesis imperfecta type 2. So just remember all the type 2. Okay, dentinogenesis imperfecta type 2 and dentine dysplasia type 2, taurodontism. Taurodontism, what it is? It is a bull-like tooth. It is a bull-like tooth. So what do we see here? We see a large pulp chamber. Okay, large pulp chamber, and also with respect to the ghost teeth. Now, ghost teeth, it is also called as regional odontodysplasia. It is also called as regional odontodysplasia. Okay, so just remember all the types 2 is associated with the large pulp chamber. Okay, that is dentinogenesis imperfecta type 2 and dentine dysplasia type 2. Ghost teeth, it is also called as regional odontodysplasia. Dysplasia. Okay, so I hope this is clear. What is the difference between dentine dysplasia and dentinogenesis imperfecta? Okay, so we have already discussed in the live classes dentinogenesis imperfecta. So what here the appear normal enamel. We see normal enamel while there is a defect in the dentine formation. So in type 2, why do we see large pulp chamber? Because the dentine production is small, is less in the dentinogenesis imperfecta type 2. That is why we see abnormally large size pulp chamber. Okay. Now, dentine dysplasia, there are two types of dentine dysplasia, radicular and coronal. Here again, there is a defective dentine formation. Now, ameloblastoma is radiosensitive or radioresistant. So just remember for your MCQ question, just remember ameloblastoma as the most radio resistant. Okay, now there have been many articles which has quoted that surgery is used along with the radiotherapy with carbon ions, but you do not have to remember this. Just remember that ameloblastoma, it is most radio resistant. Okay, ameloblastoma is the most radio resistant tumor. Now, which of the following correctly describes cancrum oris? Cancrum oris. See, the options are slightly confusing here. Necrotizing lesion. We know that cancrum oris, it is a very degenerative kind of disease. It affects the oral cavity, lips, all over the area. It destroys everything. Okay. But what kind of lesion it is? It is either necrosis, suppurative, gangrenous, or desquamative. Can anyone answer me? What kind of cancrum oris is? It is a necrotizing lesion or the gangrenous lesion. Okay, so what is the other? This was the other question. What is the other name of noma? So noma, it is also known as cancrum oris, or it is also called as gangrenous stomatitis. It is a very severe, aggressive, gangrenous process. Okay, so here the answer is gangrenous lesion. It is gangrenous lesion. So this condition, what it does, here the body tissues die due to infection or lack of blood supply that affects the mouth, nose and lips. Mouth, nose and lips. It is a severe destruction type of lesion which is occurring in the mouth, nose and lips. Now, this question was discussed by me in the Telegram group, and I'm very happy to announce this question because this question was asked in the November INI paper. November INI paper, and I had clearly mentioned that which cyst is most commonly associated with vital tooth. Now, many questions, many students, they mentioned that, ma'am, there was the question was slightly different. That the question was, which is most common cyst associated with vital tooth? See, these two questions are very different. Most common cyst associated with vital tooth, while The question, cyst more commonly associated with vital tooth. Okay, so if the question has mentioned that cyst most commonly associated with vital tooth, then the answer is lateral periodontal cyst. Now remember, lateral periodontal cyst, it is always associated with vital tooth. Why? If they have asked which is the most common cyst, so we know that which is the most common developmental odontogenic cyst, it is dentigerous cyst. See, when it comes to dentigerous cyst, we do not actually know dentigerous cyst whether it is associated with vital or non-vital tooth. Okay, so then the answer can be your dentigerous cyst. But remember that most common cyst associated with vital tooth. If they have mentioned vital tooth, then always it will go for lateral periodontal cyst. Okay, now which is the most common location for the lateral periodontal cyst? It is the mandibular premolar. Okay, mandibular premolar. Now, what is difference between Sila adenitis while Sila adenosis? Now, whenever there is a term that is itis, means it is a something inflammation of salivary gland. Okay, while Sila adenosis, it is a non-neoplastic, non-inflammatory pathology of a salivary gland. Okay. Now, Sila adenosis, it is a non-inflammatory, non-neoplastic. That means there is a no inflammation of salivary gland. While in Sila adenitis, there is a inflammation of the salivary gland. So, non-inflammatory, non-neoplastic enlargement of the salivary gland, particularly which gland? It is the parotid gland. Now, in diabetes, it occurs most commonly in the diabetes or when the patient take excessive alcohol. It is seen in chronic alcoholism. What happens in this? There is an accumulation of the adipose tissue in the parotid gland, or also it occurs as a result of general malnutrition. Okay, now very important, leafless tree pattern. Leafless tree pattern, it is seen in Sila adenosis. Okay, leafless tree pattern. While branchless fruit tree laden pattern, it is seen in which pathology? Answer. It is seen in Sjogren's syndrome. It is seen in Sjogren's syndrome. While leafless tree pattern, this is a very distinguishing feature, that is radiographic distinguishing feature, that leafless tree pattern, it is seen in Sila adenosis. Now, itis, that means obviously there is some inflammation of salivary gland. Now, this inflammation can occur as a result of infectious or non-infectious. So, infectious means that is there is a result of bacterial, viral or fungal, and non-infectious. In non-infectious, we have Sjogren's syndrome, sarcoidosis. Patient is taking radiation therapy or as a result of various allergens. Okay. Now, in bacterial, which is the most common? Bacterial, which is the most common bacterial infection? It is the acute suppurative parotitis. This is a very, very important question. Most common bacterial Sila adenitis, it is the acute suppurative parotitis. Now, viral, which is the most common virus affecting salivary gland or the parotid gland, it is the mumps, which is the most commonly seen in the children. Most commonly seen in children. Now, cytomegalovirus, it is most commonly seen in neonates, while it can also involve the Coxsackie virus. But mumps is the most common virus affecting the children. Okay. What do we see in mumps? We see bilateral enlargement of the parotid gland. Von Recklinghausen disease, this was a question which was asked. Von Recklinghausen disease is or the malignant myeloma. I hope the question is not rightly framed. Von Recklinghausen disease or the malignant melanoma, which is the most lethal disease? Obviously, the answer will be malignant melanoma. It is very, very lethal. Okay, it is malignant melanoma. Now, dental anomaly of teeth. Dental anomaly of teeth associated with defective bone formation. Defective bone formation. So, which dental anomaly has its effect on the bone as well as on the dentition? So, amelogenesis imperfecta. There is no bone pathology we see in amelogenesis imperfecta. Okay, dentinogenesis imperfecta. Now, we have clearly mentioned that dentinogenesis imperfecta has no connection with the osteogenesis imperfecta. Why? Because the dentinogenesis imperfecta occurs as a result of defect in the DSPP gene. DSPP gene. Osteogenesis imperfecta occurs as a result of COL1A1, or we can say that COL1A3 gene. Okay, so there is no association between the dentinogenesis imperfecta and the osteogenesis imperfecta. Now, so the rightly and the with this question, I can say that we can mark osteitis deformans. Okay, that is the Paget's disease. Paget's disease, though the options can be slightly more elaborate form, but if we have to mark amongst these, we will obviously mark osteitis deformans. Which of the following has odontogenic origin? Which of the following has odontogenic origin? Now let's see the options. We have juvenile semimatoid variant of ossifying fibroma, trabecular variant of ossifying fibroma, both juvenile and trabecular variant of ossifying fibroma, and cemento ossifying fibroma. Okay. So if you will know the classification of tumor, this question you can easily mark. Okay, you can easily mark if you know the classification of tumor. So it has been clearly mentioned in the classification of tumor that it classification of benign odontogenic tumor involving only from the ectomesenchyme, that is comes your third classification. In that we have cemento ossifying fibroma. So this cemento ossifying fibroma it is a odontogenic tumor. It is a odontogenic tumor. Along with it is also a fibroosseous lesion. Fibroosseous lesion. Okay. So this marks the end of your all the questions. I have tried to finish all your questions, important questions. Now, we have also discussed majority of your questions in our DBMCI Telegram group. If you have more doubts, you can directly contact me, you can text me, you can message me, or you can post all your doubts in the Telegram group. Okay. So everybody, bestest of luck. I am there for you guys anytime, whenever you want. Okay. So we will wrap up this session for today. So bye, good night, and bestest of luck. Okay.